There's a strong history of prostate cancer within my family, so I've had the conversation with my doctor, and when I turned 40, he recommended that I have a PSA test.
Despite his young age, there was no doubt in Garrick Tiplady's mind that he would get the test for prostate cancer.
With the history that my family has, it's actually quite reassuring to know that everything was within the normal parameters, and now I've got a baseline I can go back to year after year and really get a sense of where I stand.
Prostate Cancer Canada is recommending that all men who are Garrick's age be given the test.
We know from research that early detection is critical. And that if prostate cancer is caught early, in over 90% of the cases, it's treatable and lives can be saved.
We all have experiences, both me and my colleagues, where a number of men, as they get into their 40s, develop meaningful prostate cancer. So having that early baseline, I think, allows us to better stratify that risk.
Until now, most men were told to wait until age 50 to be tested.
There's a lot of confusion over the current guidelines. And quite frankly, we believe that men are dying unnecessarily because of them.
Prostate Cancer Canada is also recommending that all healthy men over 70 years of age talk to their doctors about continuing to get regular PSA tests.
Once they reach 70, there's a tendency at that stage for a doctor to say, you know, you've lived a good life, and the prostate cancer you have, you're more likely to die with than of. But we know that men live longer and longer nowadays.
A new survey by Prostate Cancer Canada has found that regardless of their age, most men are woefully uneducated about a disease that will affect 1 in 7 Canadian men. The survey found that while 87% of Canadian men aged 35 and up fear prostate cancer, less than half anticipate being tested in the next 12 months.
What we're hoping through the survey and through raising awareness is to make men more comfortable talking about their health.
The poll also found that 74% of men assume that a positive test means treatment. Not so, says Dr. Singhal.
From a patient's perspective, there's a real sense that having a blood test is going to equal or start the whole treatment machinery, which of course is not true.
Prostate Cancer Canada hopes this new information will serve as a wake-up call for Canadian men.
The PSA test is a simple blood test. And this simple blood test, together with your other risk factors, are important indicators that a doctor can use to save your life.
Garrick says he will continue to get tested. He says all men over 40 should get that baseline.
In my view, it's a great thing to have tested. You may as well be reassured.
To get more information on the PSA test and to find out when you should be tested, go to prostatecancer.ca. I'm Laura Di Battista for Prostate Cancer Canada.